we live now?
We are live.
Yes. Hi everyone, Dr. Sharon again from RTC Dental Studio with another episode of Dental Tips of the Week. And today I'm going to talk about how you need to do flossing and brushing effectively and in a short time. Here I have somebody who's helping me, who's filming me at the moment, and this is Tash, our dental assistant, one of the best dental assistants in the world, and she's fantastic. Whoever works with us is fantastic. Do you want to say hello, Tash? Yeah.
Hi guys. Hi Arthur. Oh, switch us back.
All right. So let's jump in. But before that, I need to answer a question because as a dentist, I've been asked several times that many people say our teeth are not good and structurally there is something wrong with it. This is why it doesn't matter how often we brush or floss, it gets decayed or our gums bleed or whatever. And just wanted to tell you about this because it is true in possibly just 10% of cases. In 90% of cases, oral hygiene plays a big role. And take myself as an example. As an individual, I've been doing brushing and flossing not very well in my first 17 years of life before entering dental school. And during those years, I had 10 of my teeth filled. After that, from the age of 17 until now, which is 30 years, I only had 3 of my fillings replaced. No further cavities. So, you can see how it could affect you. So, let's dive in. I'm gonna tell you exactly how to do that. First of all, you need to do brushing twice daily and flossing once. That's the minimum requirement. Some people may ask, we do mouthwash, so we don't have to brush that often. It's wrong. Mouthwash is just something like complimentary, okay? You need to do the mechanical action of brushing and flossing. So, twice brushing, once flossing. All right, let me show you our model. It's just like a King Kong size. And if you just have a look here, the areas that you need to focus on. The first area is the junction between the gum and the tooth. This is very, very critical because gum disease begins from this area and also many decays around the neck of the teeth. So what you basically need to do is to pop your brush bristles at an angle, not perpendicular, not parallel, at an angle between the gum and the tooth, and begin vibration. If you're using manual one, if you're using electric one, it's even more simple. You just need to pop it at an angle and let it rotate or vibrate or whatever. And then once you did that, all you need to do is just to stay there for 4 seconds each area. Depending on the size of your brush, the size of the area differs. And then once it is finished, for electric ones, you just pick it up. For the manual ones, you flick like this, flick like this. So for the lower ones, you just need to move upwards. For the upper ones, you need to move downwards. So this actually is true for all outer surfaces and all inner surfaces. So let me just pick up this tongue. Like inner surfaces like this. And as you move toward the inner surfaces of front teeth, both top and bottom, what you need to do for the manual one is just to brush like this. Easy. And the top one, brush like this. And for the electric one, just pop it there and let it do the job and move at 4-second intervals. The next part, which is important to do, is obviously the top surface of the back teeth. Many people usually do that very well, but sometimes they ignore the furthest back teeth. That's really important. This is where we see cavities quite often. So you need to pop this brush there and just move it all around to clean the fissures on the top surfaces of the back teeth. And the next part, which is always overlooked, is the back surface of the furthest back teeth. That's really important. You just need to pop this brush at an angle so brush bristles can penetrate between the gum and the tooth and move sideways. And for the electric one, just pop it there, let it rotate. Once these areas are finished, the only area which is remaining now is the top surface of your tongue. That's very, very important. Why? Because there are many small papilla on the surface of the tongue which could easily catch bacteria, food debris. Remember we talked about fairy tongue in the last video. So what you need to do is just to brush it different directions, you know, sideways, back and forth, just to make sure the top surface of the tongue is completely clean. So let me just put it in a nutshell. So first of all, the outer surfaces, inner surfaces, top surfaces of the back teeth, and furthest back teeth, the back surface of the furthest back teeth, and then on the top surface of the tongue. Okay, so this is the brushing. Let's go to flossing now. Let me grab my floss. If I just pop it here, Pash, I think I can explain better. Alright, so for flossing, normally the most common mistake people usually make is that they pop the floss between the teeth and push it down. As it just passes the contact between the teeth, it hits the gum, causes some pain, causes some bleeding, and they say, oh, flossing is not good for us. We better just leave it. But what you need to do is to pop it in here. As you're passing the contact between the teeth, you just need to do some sawing motion. Pass very, very gently. As you go between the teeth, all you need to do is just to move as deeply as you can and make contact with the tooth on one side, like in a C shape, and move up and down. The mistake people usually make is that they think that flossing is primarily for removal of food debris between the teeth. It's true, but the most important thing, which is always ignored, is that there is a film of bacteria sticking to the teeth surfaces. And brushing, you know, the brush bristles cannot penetrate deep enough into these cavities or spaces. So what you need to do, as you go into the space between the teeth, make a C, move up and down several times, and then move to the other tooth, make a C, and move up and down several times. And sawing motion out, going to the next space. Now, if you do such a thing properly, even if you're a dentist, you cannot finish your brushing less than 3 minutes. It's impossible. And flossing, if you're an expert at flossing, possibly at least a minute. So let's just say 5 minutes in the morning, 5 minutes at night. That's all you need to make sure everything is under control. Plus your 6 monthly, obviously, your 6 monthly visits to a dentist. I hope you enjoyed this video, and next week I'm going to talk about tooth loss. That's the problem that many of us face, and that's really important. It's affecting us. And I'm going to talk about the consequences of tooth loss and also different options to tackle that. Thank you very much. Put your comments below and share this video with your friends and family members. Enjoy the rest of your day. Thank you. Bye.